Give everyone just a minute or two to jump in here, and looks like we already have a bunch of people with us tonight. So for those who are here, if you want to hop in the chat and give us a little bit of a hello and where you're watching us from, that'd be kind of cool.
It's always cool to be able to see that.
Ash and Liz, welcome. Good to see you guys. So we're going to get started. This is going to be a little bit of a shorter evening tonight. We're going to be doing this for a half hour. Just as a reminder, I'm Dr. Josh Spitalnikc. I'm a licensed psychologist, board certified in cognitive behavioral therapy. I'm the owner of Anxiety Specialists of Atlanta. And I have with me my partner in crime for everything health anxiety, Michael Stier, LCPC, licensed clinical professional counselor and licensed professional counselor. He's also one of the directors at Anxiety Specialists of Atlanta. We're thrilled all of you are here. Allie, hello. Cameron, Liz, Ash, this is awesome. Good to see everybody here today. Just as a reminder that this live event is being offered both to the Resource Center and the OHA, the Overcoming Health Anxiety Community. And though events like this are not a replacement for therapy, they are an opportunity for us to empower and validate and strengthen the people who are battling health anxiety. So we're thrilled that you're here. And we're going to get going with the questions and answers in just a minute. Michael?
I was going to say the only other thing I'll update everybody on is that, if you're here, you have an account with the Resource Center or the community. And so, if you haven't checked out the Resource Center yet, if you've just been in the community, make sure you go in there. We have a bunch of different learning modules, videos, articles that you can check out. I even did a talk because it was a week and a half or 2 weeks ago at this point. And so that's up there now too. So make sure you check out some of the resources that are there. Also, if you're part of the Resource Center, but you haven't checked out the community yet, we kept on getting join us. We kept on getting some questions about like, what's the live Q&A like? And there's more support groups. So we wanted to try to bring this experience to everybody for you guys to check out. So in the community, there's also this live hour-long Q&A. There's more support groups. We've been having some discussions on the forum, kind of like a Facebook-style feed. And also there's challenges. We've been all introducing ourselves this past week. So it's been awesome to be able to kind of see where everybody's from, all those things. So if you're interested, it's on the website. Not only are we the co-authors of the book that's behind Josh there, The Complete Guide to Overcoming Health Anxiety, but we also created the Overcoming Health Anxiety website. So we are your fearless or maybe feared leaders. Who knows?
Fearful?
One of them.
I'm not
fearful
sure. Yeah.
leaders?
Full of fear?
Yeah. Living with fear leaders.
Living with fear, not in fear.
Yes. So we're, check out all the things that are on the website. Also, what's also important is we want you guys to be a part of this community as well. And so if you see things that you think would be interesting to see in the Resource Center, or you think would be interested to add to the community, drop us a line. The email is support@livewithfear.com. That's support@livewithfear.com. So if you do have any suggestions, things you want to add, we're always looking for cool things, because just as much as this is part of us, this is also part of the greater health anxiety community.
And this event, Michael, is because we got feedback already, which is there are a bunch of people who have joined. We have, I think about 150 people have joined the Resource Center already, which is exciting, given that we just started this about 2 weeks ago, and people want to know what the live Q&A event was going to be like. So we said, okay, it's right now primarily for the community, as is the extra support groups and everything else. So we're doing this for everyone so people can kind of get a sense of what's happening in the live Q&A, which we'll be doing twice a month in the community. Let's get going.
Yeah.
So we already have questions that have come in both from the community, from people that sent us emails from the platform, from the Overcoming Health Anxiety Resource Center and website. We want to prioritize those always as we send out emails to everyone in the community. If you have a question you want to ask, send it to us in advance, because some people don't want to put it in the chat. Mia, welcome. Ash, welcome. Liz, everyone, good to see you. If you have questions and want to put them in the chat, our awesome producer Rachel will go through them and put some of those up on the screen. So if you guys have any things you want to ask us, please let us know, and we'll do our best to prioritize those and get to them. But we're going to start with the first one that came in from someone that's in the community. And it talks about when you go to the doctor and you have some questionable symptoms and you don't know what's going on, what are you supposed to do? So someone from the community shared with us, what if I have feeling symptoms? What if I feel things? What if the doctor says it's kind of not normal, but they don't know what it is yet? What are you supposed to do? Michael, for someone who's trying to help people overcome health anxiety, when you get wonky symptoms and you're sort of not sure how to move forward and the doctors aren't sure yet, what do you recommend?
I mean, I think the first thing we have to kind of remember is that, that's a tough place to be because we're kind of battling back and forth between, do I pursue more or do I just accept the unknowns about what's there?
And when you say pursue more, you mean what exactly?
So pursue more would be, do I go for additional tests?
Yeah.
Do I reach back out to the doctor? There's a lot of different things that we could do to pursue maybe answers, medical answers. It's a tough question because there are some things that are going on that are strange. Maybe you're getting weird symptoms. Maybe they're not exactly sure why these are happening. I think one of the things that we really try to focus on is if we have a trusting relationship with the doctor and we can coordinate with them, can we try to take some of the answers that they're giving us to say, okay, they're not saying it's, I think in this question I read it, they're not saying it's super serious, but there is still the scary part of, well, should I pursue more or do I just live with the unknown at that point?
And the unknown, the uncertainty, the gray areas is why anyone struggles with any version of anxiety. Obviously, with health anxiety, it's all about sort of medical and physical symptoms, Michael. So I know one of the things that you and I often recommend is that between doctor's appointments, between MRIs, between going for that second or third opinion, between following up with your PCP and the lab results, we know that there are lots of little data points, lots of little moments for which someone can spend time ritualizing, whether it's mental compulsions like monitoring your body, thinking about what the doctor said, replaying what the doctor said, questioning, mortality and things like that, or going online and looking up new doctors or going online and looking up those weird symptoms that the doctor said it's something, but it's not anything yet. So one of the things I know we talk about quite a bit is between those big doctor's appointments, this comes up quite a bit, is what things can you do to step back from that chronic state of worry, from that chronic state of questioning the uncertainty and the unknown, and plow that energy to things that actually matter for you.
Yep. And to your point too, Josh, the other thing I'll add into this on this question, sometimes it's helpful to start to kind of identify what I would just call productive pursuits versus unproductive pursuits. Yeah. So if this person was really in this situation, I may encourage them a more productive pursuit, which is, well, you know what, schedule the test. Coordinate with the doctor if you feel like that these symptoms are still really weird, because at least you're giving yourself somewhat of a chance to be able to get an answer. Some of the other things that we might be tempted to do, which I would call non-productive pursuits, which would be like sitting up in bed at night and worrying about the things that are going on, or going on Google. I trust everybody's Google skills here, but I also know that we don't have the medical knowledge to make sense of them and to also really apply them. So in those cases, maybe what we could do is make that appointment, wait for the appointment and say, hey, I have something set up. I can pursue this. Until then, I need to get back to those valuable things in life, because all the other things that I might be doing, worrying about it on the internet, asking, our third cousin that's not even a doctor, do you think this looks okay?
Yeah.
It's just not going to give us the answer we want.
If you're looking to get a new tattoo, anybody out there, I'd get the new tattoo until then. Because ultimately, that's what we're recommending people to do, assuming that, it's not a life crisis, Michael, that there's not a real credible emergency happening, that until I find out, until I get clarity on what's going on, until there's definitive answers, the reality is most of us are sitting there not knowing. Any one of us right now in the audience, you and I, could be struggling with something medically that we don't know. We don't want that for people, and I sure as heck don't want people to spend time worrying about that. But until we know what's going on, the best medicine is doing the things that matter, doing the things that, Michael, that you said that are productive and that move you in the right direction. And anything that, as we talk about in the book quite a bit, makes your life bigger, not smaller.
Yeah.
So I'm going to follow up on this question. And if anyone else has any questions in the chat, and we have another one that's come in on the topic of when you go to your doctor and the questions and the answers are murky, we often get asked, when I don't really think the doctors are understanding what I'm saying. So it's not that the doctors are saying, we don't know what's going on. The person, the health anxiety sufferer is questioning, did I accurately convey to the doctors what's going on? Do they really understand my symptoms? When that kind of happens, I know I'm often asking people to step back and think about, documenting their concerns and sharing with their doctor, writing them down in advance. This has come up in other events like this. Documenting, having someone go with you. Those are always sort of the extra added kind of things that I like to recommend when someone is concerned about, am I accurately conveying what they said, or do I even think they understand what I'm saying? Is document it or have someone go with you. So at least you walk out feeling like you have a better sense of someone accurately communicated my concerns to the medical providers.
And I think the other thing, that I would throw into this too is that, there is a little bit of piece of this where we have to work on about, sometimes we get these concerns afterwards where maybe we had somebody go with us and we felt like, no, that was a pretty good conversation with the doctor, and I felt like my questions were answered. But sometimes there can be those little pesky doubts that live in our mind about like, oh, but what if I didn't express something exactly right so they know what's going on? And I think when we get that much into the weeds about things,
Exactly right.
exactly right. Yeah,
Exactly right.
Maybe I didn't tell it like, and if I did, maybe they would have been able to give me an answer. But at that point, we do have to kind of remember is maybe some of the questions that we're trying to answer at that point be nearly impossible to answer. And so I think that's the other way that I see people kind of get stuck. We would call that a mental ritual, right? Because we're reviewing information and we're trying to make sure. And that's one of those things that we can always try to redirect on to.
Just to piggyback on that, and then we're going to pull up the next question that's come in about checking body stuff and rituals, which is a pretty
Does
common
that happen
one.
in health anxiety?
Yeah, it happens once in a while. Once
A little
in a
bit.
while.
Yeah.
Body symptom checking. Big symptom in health anxiety. Michael mentioned mental rituals, and I just want to make it clear to anyone who's listening for the first time, people who are new to the Overcoming Health Anxiety website or community, people who are just new to this space and don't have a lot of information. In the books that Michael and I have read, in the podcasts that we listen to, in the books that we've written, in the books and the podcasts that we've been on, we make it pretty clear that we view health anxiety, which is not a diagnosis. It's just a big cluster of diagnosing problems out there. That health anxiety is very much like obsessive compulsive disorder. Academically, it's not the exact same thing, but it's kind of a sub-content area. And so when we talk about the things that we want people to not get stuck doing, you're going to hear us talk a lot about compulsions or rituals, which is language, Michael, that I know we use when we talk about OCD or obsessive compulsive disorder. But for most of us who are anxiety specialists around the country, around the world, we view any action that we can see on camera or anything that you're doing up here to try and figure out, what's going to happen, where's this going, am I sick, did the doctor understand, checking your pulse, looking at your watch, anything that's observable or invisible that's trying to solve that existential crisis. For Michael and I, we're going to ultimately call that a compulsion or a ritual. And for everyone out there, that's the primary thing we're hoping people can learn to give up and redirect their energy towards something else.
Yep. I had that kind of conversation with somebody today, and my favorite acronym is WTF. Not what you think, it's what's the function.
What's the function?
What's the function? And we think about we could call it a lot of different things, but a lot of times the structure of those things are the same, which is it's about feeling better, making sure that we have the answer, being more assured that we didn't miss something. And I think a lot of times those kind of themes are pretty common. And the other thing that's important, real quick, I'll throw in there too, if you are a person with health anxiety that it kind of feels like you have traveling health anxiety, goes from one part of the body to the other part of the body and to your leg, and then also to your shoulder, and then all of a sudden to migraines, and then all of a sudden to your toe. Try not to be fooled, because even though that it may be picking on different places in your body, it's important to come back to, it's like, but wait a second, is my brain doing the exact same thing in each one of these places where it has some symptom, it gives us a scary thought, and then we're off to the races from there.
And that doesn't mean that there's something wrong or something not wrong. It's not up to us to determine that. That's for you and your medical providers, but it's that hopping around of symptoms and you chasing them is going to keep you more stuck and keep you from having the life that you want. So, Michael, I'm going to pull in a question from Allie, who added one here bravely. Thank you, Allie, for jumping in here. And it says, what about a case in which you do have a medical issue, but it's chronic, like migraines? How do you prevent worrying about it and being something more serious or getting caught up in body scanning? So what Allie's really bringing to us is when you have genuine physical ailments or genuine chronic ailments that are documented, that are proven, and you're struggling to fixate on them, what do you do? Because so far we've been talking about, we don't know if you have symptoms, we don't know what's going on, but let's shift to the next category, which is when people actually have real medical issues or chronic issues. Michael, when someone spends time worrying about real chronic or acute medical issues, what do you think the health anxiety specialist is going to recommend?
Timely, because this was one of the discussions that we were having in the community with somebody was, what happens if we actually have medical conditions and symptoms that we're experiencing, which happens for most people, but also especially like our bodies are noisy. We're going to have symptoms. We're going to be diagnosed with things. Not exclusively all of my health anxiety people that I've ever worked with are just completely medically clear in every other place. So I think what's really important, the one thing I would add to this is there are some distinctions between what we can ask a doctor or medical professional about. So like, for instance, if it's chronic migraines or other conditions, I think I would have that discussion with your doctor to say, if this is something that I've actually been diagnosed with, what are things I need to look out for? What is kind of my go-to in terms of like, if what's my warning signs with this condition? And they may be able to give you some guidance of being like, okay, so if you have, X, Y, and Z happen, or if something gets this significant, or if you start to experience this too, seek medical care. And I think we use that as a guideline to say, this is how we become adaptive and be healthy with our medical condition.
And if you're doing that, Allie ask the question, like, how do you prevent the worry or the body symptom scanning, the body scanning? And I think consistently, Michael and I and clinicians like us actually don't recommend the prevent kind of phrases. This is going to get kind of weird, but in the OCD work, and someone else asked here, I think Ash asked about ERP treatments, and that didn't really work for me. RP or ERP stands for exposure and response prevention. And Allie's kind of asking the same question, like, how do I prevent worrying? How do I stop that thing? A lot of the interventions that we're asking about and recommending are not about stopping one behavior, though inevitably that's what we want. Michael, it's really for you and I to actually help people redirect that energy towards something else. And so if someone says, how do I stop worrying about something? I will often say, well, I don't care whether you worry or not, because first of all, we all worry. And worrying is a natural part of the process. I don't want someone to worry. I don't want someone to be sitting there suffering cognitively or emotionally. But when you find yourself in those worry moments, can you catch yourself? Can you acknowledge what the worry is focusing on? And can you put similar energy towards, it's going to get weird, worrying about positive stuff. No one uses that phrase like, gosh, I'm so worried about things working out today. I'm so worried about like the migraine going away, or I'm so worried about like feeling better today. So I know the word worry doesn't make sense, but what we're talking about is when you find yourself accidentally and almost involuntarily worrying about something you don't want to worry about, can you take that same kind of energy, which is thinking about stuff, focusing on things that matter to you? And so in this kind of moment, Allie, when you're having migraines, which can be debilitating when I've had migraines, they make me nauseous. They put me on the couch. I have to sort of go to sleep. Sometimes it's just physical rest is the best medicine. But if you're mentally sort of in this place where you are really fixated on it or ruminating or worrying, Michael, I'm going to have someone engage in some sort of cognitive activities that separate themselves from the worry, that recognize the worry, they accept that they're worrying, they don't agree with the content of the worry, and then try and mentally or physically focus on actions, sensations, or people that really matter to them. Thoughts on that?
I was going to say the other thing I would add to that too is just in a foundation of worry too, that I think some people do know this, but some people don't know this. Not saying this is easy. So there's my disclaimer. Yeah. I'm not saying this is easy, but I think it is important to recognize the difference between a worry and worrying, which is, can we stop a worry? Of course not. We're all going to have a worry, right? There could be a worry about like, oh my goodness, I hope I don't get another migraine today. That's a worry. That's natural. I'm going to encourage you to try to accept that worry, not to say that you like it, but just saying, yeah, I've had that thought. That's a worry that's come to my mind. And also, to be fair, it's a reasonable worry, right? Like, I think anybody that's had migraines would also say, like, well, I really don't want those. There's this crossover that starts to happen when we think about worrying that starts to become an action. It's about trying to problem solve. It's about trying to figure out, am I going to have one? Am I not going to have one? That becomes a very active process. that, like I said, is not easy to break away from. But I do want you to kind of recognize that it's kind of like being given like a really hard math problem. Okay, Riemann hypothesis. You can look it up online. Check it out. Really hard math problem, actually unsolvable. And if you actually do solve it, you get like $1.5 million. If I gave you that
from
problem,
not from us, from somebody
not
else.
from us.
Yeah.
Not from us. But there is this option of either I could see this math problem, which I can't control, and either I could spend time on it or not. That's my two options, right? And it's also about that redirection to, if I'm not going to spend time on this math problem, what else could I spend my time on? And so I think that's a direction we can start to move.
In the book, we talk a lot about obsessions and mental rituals and compulsions. In the Resource Center, we have an entire section of downloadable forms for anyone who hasn't fully navigated. Everyone's here is either part of the Resource Center and or the community. If you're in the community, by default, you're part of the Resource Center, but not everyone in the Resource Center is in the community. In the Resource Center, in the free Resource Center, we have tons of downloadable forms, and one of them actually helps you organize your symptoms of triggers, obsessions, and compulsions. I would encourage anyone to do what Michael just said, which is put the triggers to the side. I mean, sometimes Allie and other people, migraines happen just because you have migraines, but the worry that you're having, we would call an obsession. Worrying becomes the compulsion. And if you can organize your thought symptoms about things that are, I use hand gestures in therapy, that are happening to you, and Michael used to talk about being active or productive, versus the verb of worrying, the things that you're doing or trying to solve. If you can tease those apart and separate those out, you've now just identified that there are things that are happening to me. I'm worried about having migraines that you can't really do much about. And then you try and start problem solving around them. You're spending energy in that wrong direction. So understanding your symptoms of worries that you have and then worrying about worries, that's its own masterful skill. And if you can do that, then I'd have anyone say, okay, now that you know what the things that you're actually worrying about, the act of worrying that you're doing, we've got to come up with other cognitive, emotional, behavioral tools that you can do to take that energy elsewhere. And that would be the most important thing I'd recommend at this point. Okay. So Ash asked a question about treatment options about for OCD and health anxiety. So again, just to reiterate, Michael and I are coming at this, and most anxiety specialists are coming at this to kind of view health anxiety as a sub-content area of obsessive compulsive disorder. And if you look on our website, if you go to the Resource Center, we outline all the research that's out there about treatment, about documenting it, about diagnoses. And the research is pretty clear, Michael, that treatment follows several kind of approaches. ERP, or exposure and response prevention, something called ACT, acceptance and commitment therapy. Both of those interventions, for everyone out there listening, are subtopics under a big umbrella called cognitive behavioral therapy. And under cognitive behavioral therapy, Michael, there's other interventions that people can pull from, as well as we haven't even discussed medication. So we get this, question quite a bit, Michael, when someone comes in and says, listen, I tried ERP and it didn't work for me, which it doesn't work for everyone. No intervention works for everyone. What are my other options? What are the other options?
So, and for anybody that has the Resource Center, there's a whole tab under the science that you can start to kind of look at if you really want to kind of nerd out at some of those things. And I think what's important with this is that, there's things that when we think about scientifically that we've shown to be proven to work quite well. But the word is not perfect.
Yeah.
And so we have a lot of people that come in. The question that I always ask in the very first part of a statement like that is I think it's important to, talk with the person and be like, well, when you say ERP, what exactly did you do? Because there's a lot of people that maybe would even say, oh, they treat, OCD, or they use ERP. And for sometimes they're correct. And sometimes you might start to kids like, was treatment done in the most effective way? Now, maybe let's say it was. We also have to remember is everyone's an individual. And so I have people that maybe, ERP works somewhat well, but they really appreciate an ACT perspective, which is a little bit different.
When you say ACT, we're getting away from the exposures, getting away from fear challenges specifically, even though anyone who talks about their worries, Michael, is already facing some of their fears by even thinking about it and talking about it with a therapist. But when you say ACT, we're talking about a little bit of a different kind of intervention than facing your fears and giving up rituals. Just loosely, what is ACT for people listening?
Totally. Yeah. So ACT would be, instead of, what Josh was kind of describing is, we're talking about acceptance and commitment in terms of, can we create some acceptance around some of the symptoms we have, maybe even acceptance around some of the scary thoughts or ideas.
And hold on, acceptance doesn't mean agree, right?
Correct. Just means acknowledging the presence of.
That's hard to do.
And you don't even have to like it.
Because, that's hard. That's hard to do, to acknowledge the yuckies.
Oh my goodness. Yes, it is for sure. And so that's my client's favorite word. And I was like, let's talk about acceptance. And they're like, oh no. Okay.
It's hard because you're asking someone to, again, it's not exposure therapy, but you're asking someone to spend time honoring and recognizing things they don't want to think about. But by doing so, I like to use the concept, keep your friends close and your enemies closer. If you can accept those unwanted thoughts and feelings without over-interpreting or agreeing with what they might possibly mean, which for most of us who have health anxiety, it's something catastrophic, doom and gloom, accepting the presence of something uncomfortable, and then committing to actions that you think, that's the commitment part, that you think improve your life, upgrade your life, make things better. And that's when we talk about redirections, doing pleasurable activities, connecting with people or experiences that really uplift you, make you feel good. Exercise is a great one. Michael's recommending the concept of acceptance, but not sitting there and wallowing in your miseries and ruminating about it. It's acknowledging something happened to you and then doing your absolute best to pick yourself up and do something else because you have the ability to do so. It's just hard to do sometimes.
For sure. And I just saw Liz put in another question for us too that kind of ties to this as well, which is, just kind of sharing, and thank you, Liz, for being so vulnerable and awesome to ask this question of just about this piece of like there can be trauma around some of the medical conditions and experiences in medical care, which if we just try to approach maybe a complicated presentation, right? If you have trauma and you also have health anxiety, it can be hard to say just one treatment is going to be the end all be all of those. And so sometimes we have to combine treatments. There's some evidence-based treatments around PTSD that we can, that can be, I've had to have people go and work on since I'm not a PTSD provider. And so there's a lot of complications. I think what's important with that though too, is finding a licensed professional that you can work with to ask those questions. And I think it's really important that they're open to talking about the different options, the different things that you could try. I never really liked the idea of just trying something harder or more. Sometimes we have to get creative and try something different too.
So Liz brought up, I think, a really important issue, which is that when people are struggling with any sort of mental health condition, it's rarely by itself. It's very rare for us to treat someone with health anxiety who's not either feeling a little bit depressed or preoccupied with stuff, maybe being a bit inattentive or focused on other things. Anyone who's struggling with health anxiety is probably struggling with something else. And a therapist, a clinician, their goal at the beginning is to really understand all the different problem areas that you're going through and how your loved ones, your husband, your wife, your children, your support system, what are they going through as well. Michael and I really enjoy working with the entire family system, and a colleague and I run a support group just for romantic partners of people who battle health anxiety and OCD. But I appreciate Liz bravely bringing up the topic of PTSD because almost anyone who comes in for therapy is probably, if they're battling health anxiety, battling other kind of things. And that's a discussion you should have with your clinician, which is the things you're struggling with, because it's their job, the clinician's job, to try and figure out sort of the chicken and the egg. What should we start with right now that's going to give you the best chance to recover and get back as much life as possible in the briefest amount of time? And sometimes that may not be starting with health anxiety treatment, Michael. As you said, like sometimes someone needs to go work on trauma or depression. But if we can get to health anxiety right away and help them give up some of the actions, mental and behavioral, that they're doing that are keeping them stifled and stuck, you can have breakthroughs. And that's why Michael and I love doing this work. It's frustrating and sad to see people struggle. We built this community specifically because people were feeling like they were doing it by themselves or there were not enough resources out there. Again, we are members of and fans of a big organization that supports OCD research and clinical work called the International OCD Foundation, but there's no gigantic health anxiety foundation out there. So Michael and I, a few years ago, wrote an awesome book that we're quite proud of. And from that's come experiences like this, where you guys have asked us to bring more resources to you, bring more touch points to you, Michael. And so tonight, this live event is just a short half-hour window into, if you're in the community, we do this event twice a month. We do 2 support groups a month. There's many ways to interact with us in the resource center by downloading stuff, by watching videos we've been a part of. Thank you, Rachel, for putting that up there, the OHA community. But most importantly, you're not doing this alone. And so hopefully you find a good clinician out there and you find someone that can help you understand the problems you're going through. But this resource, this live feed, the platform Michael, you and I have built, is all about connecting people so they're not doing this by themselves.
For sure. And the one reminder I'll just give to people too is that, while we are treatment providers, the resources that we're offering can't replace treatment. That's why it's really important to make sure that you're working with somebody that can attend to your specific needs. But we hope that between the resource center and the worksheets that you could try out, and like the TOs and Cs worksheet that's up there, and also that piece of the connection, I think is can be really important. As we kind of get close to 8 o'clock here, well, 8 o'clock for me, 9 o'clock, and who knows what other times we have going on here. As we kind of get to the top of the hour, I just want to thank everybody for joining us today. Check out some of those resources that are in there. And I am serious when we say it's like, if there's other things that you would like to see added, included in the resource center or the community, give us some feedback. We want this to be as much of a place that we built for you, but also a place for you that really kind of feels like it's speaking to your needs and the things that you want. So, so check out the website, and then we'll catch up next time.
Liz, Allie, Ash, and those of you who helped us out tonight and contributed, thank you so much for your bravery and your compassion. Have a good evening.